So far, we've discussed all of the things that you need to consider when selecting interventions for your clients. But now we'll talk about the process of treatment planning. How do you actually go about developing your treatment plan? So, of course, both the client and the helper are actively involved in the choice of the appropriate treatment strategies. And it would be a misuse of the power that you have within the therapeutic relationship for you to implement a plan independent of the client's input. That would be you using your power to make decisions for the client, and that would be inappropriate. So you always want to engage in shared decision making. So, how do you document your plan of care? What should your treatment plan look like? First, you should identify the referral source and the reason for referral. You'll document your clients presenting complaints and any additional or related concerns that will be the focus of treatment. You'll identify client strengths and resources. What skills, abilities, or support systems might the client have that can help them in the change process? You'll identify client liabilities and potential barriers to treatment, and you'll give your client a diagnosis, in this case using the DSM-5. And then you'll outline the goals negotiated by the helper and the client. And of course, you'll want these goals to adhere to the characteristics of effective treatment goals that we discussed last week. Next, you'll want to identify the treatment objectives. And these are the means or methods of achieving the goals. So the interventions here, you outline the particular strategies or interventions you'll use to help the client achieve their goals. Then you outline the helper interventions. What part of this plan are you as the helper responsible for? So you may have to say that you're going to consult with colleagues. You may be responsible for psychoeducation and gathering books and resources to educate your client about their particular issue. You may be responsible for setting up exposure experiences where your client will be exposed to a situation that uh, triggers phobias or fears, and you might help them through that process. So what part of this exactly would you as a helper be responsible for? You also outline client implementations. So what will the client be responsible for? So they could be responsible for things like doing homework assignments. They could be responsible for journaling. They may have to do behavioral experiments where they're going outside their comfort zone and striking up conversations with strangers or getting involved in social activities. So again, you'll outline exactly what the client will be responsible for. You will document if you need to make a referral for an evaluation. So is there any bit of information that you need that you as a therapist are not able to obtain from the client? So these could be things like an evaluation for medication. You may have to refer them to a psychiatrist. You may need a speech evaluation. You may need them to have a medical checkup. So here you would notate if you have to refer them out for any type of evaluation. And the information that you're sending them out to be evaluated for, that needs to be something that will inform your treatment. So you're not just having them be evaluated for the sake of it, you're seeking some information that will then inform your treatment of the client. Next, you'll need to document the length, duration, and frequency of treatment. So number one, how long will each session be? How often will you have sessions with the client? And then for what period of time do you expect to continue to meet with the client? So for example, 1 hour once a week, and you anticipate meeting with the client for 6 months. And again, you're going to be constantly revising this plan. Those parameters may have to change, but you do at the outset want to say what you anticipate as far as the duration of treatment. Then you want to identify the criteria for treatment termination or transfer. So at what point would you know that it's time to terminate treatment? And that could be because the client is not progressing. It could be because the client has reached all of their stated goals. So how do you determine when it's time for termination? And how do you determine that it's time to transfer the client to another helper who may be better suited to work with them? You'll also identify a treatment plan review date. So when will you come back and assess your client's progress toward their goals? And then you also identify the prognosis or make a prognosis. And so this is your prediction of how much improvement the client will have made by the review date. So based on Client characteristics, the severity of the client's problems, their resources, and their potential limitations. You'll take all that information into account to determine, what is the likelihood that the client will meet these goals by the review date. And then finally, you will outline responsible staff. So if anybody is responsible for any part of this plan other than you or the client, you need to identify what people within the staff will be responsible for carrying out each part of the treatment plan.